Why? Why do you say you love that?
I always love women's health. So anything women's health, postpartum, pregnancy.
Yeah, you have to.
Closer?
Yeah,
Okay,
there you go.
Hey.
There you go.
So anything postpartum, anything pregnancy, fertility is my absolute favorite. I'm all for it. And I think it's so important because it's not talked about enough. So I could appreciate that.
What aspect do you feel should be talked about more? Like what aspect of women's health?
I think especially postpartum depression, because there's such a stigma and a lot of women just don't know how to go about it. And sometimes they don't even know that that's what they're experiencing. It could be as simple as an intrusive thought, or their hormonal levels do drive a lot of their mental status and ability as a mother to just give as much as they want to. And sometimes they're holding back because they're feeling uncomfortable, they're not feeling well. So it could be so many different things. But yeah. Mm-hmm.
And so what are some things that you look for in a woman who comes to you with symptoms of postpartum depression?
So mostly the women that do come with postpartum depression, they're aware. They're already not feeling like themselves. They're not motivated. And they just don't have the drive that they used to before they had their baby. So I would look for if they're not sleeping. Obviously, if you have a baby, you have to wake up in the middle of the night. Changes things, that's okay. But if you're not sleeping at all, insomnia, if you are having those intrusive thoughts, like, is something going to happen to my baby if I'm not around them all the time? Also, women, when they're going back to work, that they are not able to focus, things like that. And then there's also the, depression, just wanting to stay in bed all day, not wanting to take care of yourself. There's just certain things that you'll notice that they're just not regular for a woman.
Got you. I'm gonna backtrack for a second so that people can understand who you are and where you're coming from.
Yes.
So, Dr. Denise Suarez. So you mentioned to me you were born in Cuba. You left at the age of 5.
Yeah.
You came here to the United States. So you go through high school. At what point did you feel that you wanted to, I guess, branch into medicine?
So I always had a feeling that I was going to end up in medicine. When I was younger, I loved psychology. So when I was about 13 years old, I would pick up any kind of self-development book, astrology, loved astrology, still do. But to me, that was psychology.
Okay.
So I would tell my parents, I'm going to be a psychologist when I grow up. And then fast forward in high school, I got really into my creative ability. So I looked into drawing, painting, graphic design. I used to love coding. I would sit on my computer, no idea what I was doing, but I would just code. Blurdy back then. I don't know if you know what that is.
I have no clue what that is. What's Blurdy?
Blurdy is like a journal.
Okay.
So you remember LiveJournal?
Nope.
Whoa.
What is
This
it?
is a throwback.
These are like blogs or what?
Yeah. So
Okay.
it was like a blog before MySpace.
I don't remember anything before MySpace besides AOL chat rooms. That's about it.
Well, it was driven by that.
Okay.
So you would, write on your journal or your LiveJournal, your Blurdy, and then you would have conversations with your friends. And you would just share whatever you felt. And you can decorate it and all of that. So I was very much into that back then. And that led me into high school, taking some courses, some photography. I was in an art class, and I also wrote a lot of poetry. And one of my teachers encouraged me to go to art school. So I did. And I went to the Art Institute. And it was great, loved it. But when I started my job at the advertising firm,
So wait, how old were you at this point at the advertising firm?
So I graduated high school at 18,
Mm-hmm.
and I went right into the Art Institute that same year. So I graduated in 2 years. I finished a lot of my college courses in high school. So once I was able to move quickly, I finished college in 2 years.
So what? Because you were an AP student in high school?
I was.
Okay. No, that's fine.
I was in gifted, and I was in AP. And then I took some courses at Miami-Dade. So I took like the English and the math and all of that before. Mm-hmm. And then in art school, you do have to take those prerequisites. I didn't have to take a lot of them. So I went straight into the arts. And I graduated when I was 20. Yeah, by the time I was 20, I already had my advertising degree. So then I went
Has that
on.
been helpful to you since you do have an advertising background? I mean, obviously it was between the ages of 18 and 20, but then you graduate. So I'm sorry. What did you do then? You said you got your first job. I'm interrupting you. I'm so
No,
sorry.
please. Yeah.
So you got your first job. Where were you and what was your role there?
So my first job, I actually worked at a CrossFit gym. My first job was in high school, but
Okay.
that didn't count because it had nothing to do with advertising.
Gotcha.
Then my first job that I was kind of able to explore that was a CrossFit gym called CrossFit Gables. And I was the office manager, but it incorporated a lot of event planning and some of the advertisement and things like that.
Mm-hmm.
Then after that, when I graduated, I did work for a firm called M8. So it's called Media 8.
Okay.
I worked for them briefly and I just did not love it.
But what were you doing there?
I was working front desk and then I did a little bit of copywriting.
Gotcha. Okay. So you decide, okay, this is not the journey I want to go on.
No. And at the same time, I was opening my own CrossFit gym.
Okay.
So that was fun.
So how did this come about? Just because you were exposed to CrossFit as your first job
Yeah.
and then you just loved it and you decided, let me open up my own box?
Yeah, I felt like I needed to explore that. I was obsessed with CrossFit at the time. It was everything from the fitness to the people to having my own box. You call it a box.
Yeah.
Was my dream. And since I had that advertising and graphic design background, I was able to explore the opening of the gym and branding and all of that. So I was living in Fort Lauderdale at the time, and my boyfriend back then, he had the means to fund, and I was able to help him with what I knew how to do. So we opened our own CrossFit gym.
And what was that like for you? Because you're 20-something, early 20s, you're
Yeah.
opening up a business. What was that experience like? And what gave you the courage to, I guess, step out and do that? Because I think that's where a lot of people hesitate, right?
Yeah.
A lot of people have this idea. They want to take that step, but there's some sort of barrier that they just say, nah, let me just sit back and let me just be comfortable where I am. And they let those dreams kind of fizzle. What makes you take that step to I guess, initiate even starting a business?
I was never afraid.
Fear.
Yeah.
The lack of fear.
Yeah, I was never afraid of, I guess, like the underdeveloped amygdala.
Yeah.
You're not afraid of anything at that age. But I just wanted to do something, and to me, it didn't matter how I would get there. The steps would just lead me there. And I've always had a lot of faith. So, we're allowed to say this.
Of course. What do you mean? Why would you not be allowed to say it?
Well, I believe in God,
Yeah.
and my faith is very, very strong. And I always felt like I was driven by another purpose. Like I am a vessel, and I'm just being driven to do something, and I'm just going to go for it. And why fear? Why have that fear? If it's meant to be, it will happen. If it's not meant to be, it's not going to happen. And that's okay. So, yeah,
Do you
I
still
just
carry
went
that mindset today?
I do. That's my biggest drive. Just having that courage, because I know that at the end of the day, it's obviously free will, but we're being guided by something so much greater.
That's awesome.
Mm-hmm.
So you open this CrossFit. How does it do? What happens?
So the CrossFit's called Riptide CrossFit, by the way. It's still there.
Okay.
I don't own it anymore. And at first, businesses can go two ways. It can be extremely successful right off the bat, or it's going to take a while. In my case, it did take a while. I did not really see the growth until the second year. And at that point, I was already moving out of that space, a relationship, and I was already moving towards medicine at that time. So the gym was there. I think I completed my purpose. I created some of the branding. There's a beautiful mural on the wall that I was able to help paint and all of that. So that was that.
Was it difficult for you to move on since you were there for the birth of this creation, right? And I think a lot of us have difficulty parting ways with things that we create. Was that hard for you?
At the time, At the time, yes, because I felt like my dream to own a CrossFit gym, I was able to do that, but it wasn't what I imagined it was going to be. The work itself, it was really tedious. My car was broken into one day when I was just parking outside and I was still in the car. So there were moments where I was like, what am I doing here? I was closing the gym at 11 o'clock at night sometimes, having to clean it myself, which is not a big deal, but by yourself in an area that wasn't exactly safe. It's like next to a courthouse, and those things were difficult. And at the same time, I had other things going on and just not making the money that I thought I was going to make. So, yeah.
Okay. No, it sounds, I mean, it's definitely difficult to open a business and then you're going through the day to day, because on Instagram, what are we showing? We're showing like, oh my God, I own a gym, like come see us, but nobody understands what's going on in the background.
Yeah. And Instagram wasn't even a thing back then. At least it was starting to be a thing. So it was mostly Facebook driven and just word of mouth. And as much as I loved starting it, leaving it was more just, it was natural. It was time for me to go. It was time for me to move on. It felt like that.
Gotcha.
And it was very tied to my relationship at the time. So once my relationship started to fizzle out, so did the business.
Did your passion continue for CrossFit? Because I know you showed me pictures. You were pretty jacked. Let's just put it out there.
Crazy.
Yeah, you were pretty jacked. So did your love for CrossFit itself also fizzle with that transition?
Actually, my love for CrossFit grew.
Okay.
Because once you're in that space of constantly doing it and you're in it and you're in the business side of it, you lose sight of your athletic, I guess, passion. Like I wanted to be an athlete and I didn't have the time for it at that when I was working so hard. So when I left, I had so much freedom and I was like, hey, now I can just be a member at the gym and not have to worry about all this stuff. So that's when I really got into it. And I decided like, I'm going to do some competitions. I'm going to get jacked. I'm going to do the fun stuff. So yeah, my love for it grew actually.
And something that we were talking about before we started recording was that I think you asked me, how are you doing all these things? And I turned and I asked you, I mean, the same way that you dedicated yourself to getting jacked. And I feel that people who are extremely dedicated, I'm thinking about my friend Alex, right? My friend Alex has transitioned his life from becoming, we joke with him, from bartender to barbender, but he's a personal trainer. Yeah. But he's in this zone right now where he's cold plunging daily. He's getting into competitions. He's just very invested in self-development. And I can see, and I knew this through myself already, but I'm seeing it in somebody else in real time. His life kind of evolved where he's working so much on himself that it's almost inevitable that it's going to trickle out to other parts of his life.
Yeah.
Right. And I think that's the part of fitness that I want to emphasize even more. I think so much of us fixate on getting jacked and looking good. But the changes that happen from a mental standpoint, the drive, the consistency, the discipline, we talked about the community that forms around that. I just think it's pretty cool. And so to me, it says a lot about a person when they do push themselves to those limits, because I know that it trickles over to other parts of their life.
Yeah. Yeah. It's usually what drives you. And same goes for you. Like exactly, I ask, how do you do all of this? Or how did you get into so many things? And you were able to deliver that. And I think it is the consistency, and it depends on your character, your personality. I've had so many jobs, like so many. If you look at my resume, kind of like, when did you have time to do all of that?
Like what? Let's go through some of these jobs. What random jobs have you had?
So I worked at a morgue, for example.
You worked at a morgue?
Yes.
I've always thought of owning a morgue. I mean, it's a great business. Let me tell you.
I'm there for it.
Yeah, it is a great business, right? Yes. Everybody's dying.
Everyone needs a morgue. So that was very cool.
Wait, how long did you work in a morgue for?
It was just a few months. It was really not like, it wasn't a long-term job. They just needed somebody to fill the position. So I worked at Miami Children's Hospital for some time.
This just got heavy.
Yeah, I know, right? The kids. Yeah. I was working as an
This was fun for a second, and then
And then we were like-
you just hit me in the stomach. Come on. No, go ahead.
somebody's got to do it.
That's
It's sad, So I worked as a perioperative aide, and I was also seeing.
Oh, wait, I'm sorry. The morgue had nothing to do with Nicholas Children's.
No, it was there.
Oh.
Yeah. It was connected. All of it was connected.
Okay.
So I was working at Miami Children's Hospital, and they just needed someone for a little while. So I said, hey, why not? I was a student, needed to make the money, and I was open to anything and everything that was medical at that time. So yeah, the opportunity presented itself. I did it. I worked at a law firm. I worked on Norwegian Cruise Line in food and beverage. Funnest job ever.
Like you would go out on the ships?
No.
Oh, okay.
No. I worked in the office, in the corporate office.
Okay.
But I did a lot of the work with the culinary department. So with the head chefs and executive chefs and anything that had to do with food and tasting the food and writing the menus.
That's why you were enjoying it.
Oh, yeah. I love that job. I was a teacher. I was a 4th grade teacher. Right? Things just got real interesting.
Your resume has shifted.
Like what? Let's see what else. Yeah, I've had so many jobs.
So some people might say, at least the old school way of thinking is, this shows somebody who, like somebody we just met. He said, I prefer to be stable.
Yeah.
I've been here for 25 years. And when he said that, so we just met with someone who has been employed at one particular place for 25 years. And so when he said that, I said, like, damn, I can't do that. Like, I'm the type of person who does bounce around. And I think the old school mentality is you got to be stable. You have to hold that one job, and it looks bad on your resume if you jump from job to job. But for me, it's every 2 or 3 years I'm shifting. I'm going somewhere else. But that's just the way my mind works.
Yeah, mine too. And it wasn't really a choice just because I was like, hey, let's see how many jobs I can have in the next 10 years. And there's a certain stigma again around that. Like if somebody has too many jobs, they're a flight risk or they're someone who's not consistent. But for me, it was a matter of having to make money because my parents couldn't help put me through school. I had to do it on my own. They provided all the emotional support in the world, but they couldn't financially support me. So someone who's a first generation, I'm the only one in my family that graduated college and university, and I wanted to do it. And I was like, nothing's going to stop me. Why am I going to limit myself? If an opportunity presents itself, I'm going to take it, and I'm going to do the best that I can with it. And again, who knows where it's going to lead me? So it was a matter of, means to an end, but also because I had the drive and the passion to just give everything I had to every job.
So at what point did you transition and go to... So explain to me the difference between... So she studied traditional Chinese medicine, which is AKA Eastern medicine. Is that different? Are the prereqs any different from a traditional MD program?
Yeah, there's a lot of differences. So basically you have to do all of your pre-med. Some students choose to do it differently, but then it depends where you want to go with your career. There's a limit. So you have to have your degree in biomedicine. So with that, you have to study all the biology, you have to study the chemistry, the biochem, and then you have to do pharmacology, obviously the physiologies, the anatomies, all of the prereq courses that you would do as a pre-med student. But then you have to add the Eastern side. So the Eastern side, it's very philosophical. You take all the Chinese medicine courses from the, philosophy of Chinese medicine, yin and yang, the Taoist philosophy. And then you also study the intricacies of the acupuncture, which is the meridians and organ systems. And then they tie it into internal medicine. So you take the internal medicine the Western way, and then you take it the Eastern way, and then you marry both of them.
So there is a blend for you.
Yes.
So why do you think that traditional MD programs haven't taken in some of the Eastern philosophies, especially if they are effective?
I think it's more of a lack of knowledge out there. It's not because it's just not talked about. So how would you know about something that's not talked about? It's not common. It's not something that you see at the hospitals. Nowadays, yeah, a lot more. Cleveland Clinic has an amazing acupuncture program. University of Miami as well. And I think that now there's just a lot more growth in the field, as well as people who are willing to talk about it and also relate it to Western medicine, because they could be so different depending on who you speak to.
Like Western and Eastern?
Yeah.
Okay. Because you're saying that you've married them. So for you, in your mind, there's a definite blend.
Yeah.
But for other people, they're completely separate.
Yeah. Again, it depends on what you believe in.
And where you were trained, maybe too.
And where you're trained, yes. Some schools just they based on elements. So we learned the elements. We learned to treat based on fire, earth, metal, water, and wood. You speak about that and you tell someone, I'm treating you based on your fire element. They're gonna say, what in the world are you talking about?
Mm-hmm.
And so then that's the difference. Like you can't just say that sometimes, because some people are just not into it. But if you're able to explain, like, hey, okay, yin and yang, for example, I can treat you based on yin and yang, but the yin and the yang, if you speak in Western terms, it's talking about the nervous system, sympathetic versus parasympathetic. So that's when you start understanding, you're like, aha, I get it now.
Yeah, because you're just throwing out terms and they have their own definition, they have their own definition of that term without understanding that for you, there's deeper meaning behind the vocabulary that you're using. They're just thinking about the symbol that they see in a karate dojo or something.
Yeah.
Yeah. So they're like, oh, this lady's full of it.
Yeah, it's
right?
confusing. Like, what are you talking about?
Yeah.
Right now?
So it's almost a matter of ignorance. And in the Western world, we're very guilty of this, right? We try to, whatever we don't know, we just kind of say it's dumb.
Yeah.
I can be honest with you. When I was in undergrad, I did a study abroad in Chile, in Viña del Mar. And I'll never forget, I thought when I was going to Chile and South America that their medicine was going to be antiquated, that America has the best of everything, is what I've been taught since I was a child.
Mm-hmm.
But then when I went over there, I was like, wait, this ICU is nicer. They have newer equipment. Wait, they're talking about evidence-based treatments that we're not doing yet, but we've talked about implementing. So I remember just thinking, oh, wow, like had I not had this international experience in the medical field, then I just would have thought that we are the elitists.
Yeah.
When we rank like 28th out of all the Western countries in terms of morbidity and mortality and just health in general.
Mm-hmm.
So it's just interesting when you don't know how you just judge instantly.
Yeah, you were going to use the word ignorance and then you stopped yourself.
I meant to use the word ignorant. Yeah, you're right. It is ignorant. It's ignorant, right?
It can be.
Mm-hmm.
And I think that now we're so much more open to different concepts and beliefs, and spirituality is such a big thing right now. And I think that that's what's driving this change, that people are much more open to learning a different way to heal. And I believe that as human, we have all the tools to heal within ourselves. We need external help. We need our doctors. We need the hospital. We need pharmaceuticals. But you can't, in my opinion, you can't just stick to one thing. There are so many different ways to go about it. We're made up of tiny particles. How do these particles function? Why does the full moon
influence how many people go to the psych ward or the ER?
Just there today, and it's true. But there's something that's so like woo-woo. People don't want to talk about it because it's not tangible. It's not understood. People want something that you can see on paper, but mind, body, and soul.
So for reference, we began the day with touring a psych ward. For those of you guys listening and don't know what we're talking about, we weren't admitted to a psych ward. We went there to visit and just to see the psych ward, to form a relationship between that psych ward and AMP. So I took Dr. Suarez with me, and it was pretty cool. It was nice to get over there.
It was great. Thank you. for
No,
that.
oh, please, you're
Love
welcome. It was a pleasure to take you. It was interesting to take somebody again who comes from this Eastern philosophy and just kind of, that's why I started asking you questions about, hey, how do you treat psychosis with acupuncture? You're like, no, start with meds first.
Mm-hmm.
So you go to school, right? And you're in traditional Chinese medicine school. What was that like for you? And you mentioned it was in Kendall.
Yeah.
Yeah, which was bizarre to me too.
Right, like middle of Kendall. It's actually a school right by Miami-Dade. It's private, and it's been there for a really, really long time. So it was at first a shock coming from, just regular college to a tiny, tiny school. All the professors were from China. So the language barrier was a big challenge for me. At first, I couldn't understand a word they were saying, and everything was so fast. A lot of what you learn is in Chinese. I don't speak Chinese, by the way, but it's in pinyin. So they'll write out the word for you so that you can pronounce it in English, but it's a word that's Chinese. So a lot of it was that, having to memorize those words and familiarize yourself with the words, as well as there was a lot of the philosophy of the yin and yang. You talk about the Taoist beliefs. You talk about meditation a lot, which is how acupuncture was actually found in the beginning of time. So it was a mix of the spiritual and the education, and it was so beautiful. To go into school and in the morning we would practice qigong. Do you know what qigong is?
I don't. Is it like Tai Chi?
Yes.
Okay.
Very similar to Tai Chi. So imagine that's the first thing you practice in the morning when you get to school. So we would do that.
So slow, very meditating,
Yeah.
slow movement.
Yeah.
I feel that yoga, something like Tai Chi, would benefit so many kids to just slow themselves down, to really zone in.
Mm-hmm.
But to implement that in our society, to even have the kids buy into it, I don't even know where you would start. You would have to have somebody who's just like an expert, right?
Well, actually, when I was a fourth grade teacher, one of my jobs, when I was a fourth grade teacher, I would teach the students and I would play these cartoon videos of little characters doing yoga and meditation, and they would follow along with it. And they loved it. They would ask me, Miss Suarez, can we do yoga time? Can we do meditation time? And it was just another way for them to relax. And it was just the sweetest thing. And I can see that you can implement it. It's just a matter of helping them understand what they're doing. Just explain it. Hey, we're going to have some brain break time. What's brain break? We're going to do some yoga. We're going to do some meditation. And it really relaxes them. It's unbelievable.
Yeah, I'm just thinking about kids right now, how if you watch cartoons, if you watch TikTok, if you watch everything now, it's short, rapid clips that are just firing away, just one behind the other.
Yeah.
Compared to the cartoons I used to watch, which are slowly developing.
Yeah.
So what is that doing to the formation of that child's brain? What kind of neuroregulation do they have? Or do they even have the ability to sit down and focus and read for a given period of time? And it's extremely, we're not doing anything to help these kids.
Yeah, and I think that's where the overstimulation comes from.
Mm-hmm.
And then you're overstimulated, and then you get to the point of needing ADHD, ADD medication because you just don't know how. It's not that you can't. You don't know how to get to that state of calm. And it's just a matter of reteaching. The brain is so magnificent. You can rewire the brain. According to research now, we can rewire the brain.
Mm-hmm.
So why not start educating at a young age? There's so many tools that we could use.
And we know all of this, but we're not doing it, right? Like not everybody is a teacher like yourself who has a fourth grade class in front of them, who has that platform, who is also aware of regulating the nervous system. Let's slow down their minds. Let's slow down the way their brain is firing. Not all teachers have that, right? Not all teachers have that knowledge behind them. So it's almost a matter of training that workforce if we're really going to invest in it.
Yeah.
Anyhow, I digress.
I love it.
So you finished school. How long ago? How long have you been practicing traditional Chinese medicine?
I graduated in 2021.
2021. Okay, so
Yeah.
you've been for 2 years. And I know currently you have a private practice. If you want to plug, please feel free. Yeah,
Thanks.
please. Yeah, for sure.
Yeah. So I work in Coral Gables. I rent a space in Coral Gables.
What's the name of your practice?
Sway.
Sway.
So it's SUAY. It stands for show up as yourself.
Very cool.
Thanks. Yeah. So that's just all I need. I just need the person to show up and I do the rest, where it's a relationship, it's a friendship, it's whatever they want it to be. I don't necessarily believe in the like just doctor patient relationship. I think there's a actual relationship that's built with trust and really understanding the person. No embarrassment, whatever you tells me, we're here. Let's work on it. Let's unpack it. Let's bring the baggage. Let's do it.
And that's so important as a clinician to have that mentality, because I actually just posted it this morning. I don't know why. I was driving and I was like, I remember I was having these memories of people who were very hesitant to ask certain questions during an initial assessment. Sometimes it's about sex. And I was just like, well, asking somebody about their sex life is going to tell you a lot more about just them in general. How often are they having sex? Are they unable to perform sex? Do they have a partner to have sex with? How is that? Or they might tell you, that's disgusting. I don't want to touch him. He lives with me, or she lives with me, but we have no desire to be intimate. We sleep in separate rooms, et cetera, et cetera. We're only together for the kids. Whatever the case may be, I'm only with him because he has money. Again, but if you don't get into these questions as a provider and just get rid of whatever bias that you hold or fears that you hold and just ask it open and objectively and come ready to allow them to show up as themselves, then you're just going to be a much better clinician. That relationship is going to get much stronger because you're not going to be addressing things that are unnecessary.
Yeah. Like we're doing right now. We're having a conversation. There's no pressure. You just get to know someone on a deeper level. And like you said, knowing someone's sexual history or how they're experiencing it at the moment tells a lot about where they are at in their life. And then you build that trust in that relationship, and then so many other things come up, and you know how to guide the treatment based on that. It's not just all on paper. We're human. We have so many intricacies.
The same as you were talking about faith and religion. And to one person, faith mightn't have any relevance whatsoever, but to another person, it might be the driving force in their life. It might be the reason that they find purpose and motivation, and the way that they live is constantly with this relationship where they're communicating with God in every situation and circumstance. That's so important, because if you want to get them to lose weight or live a healthier lifestyle, you better involve their faith. You better involve spirituality, regardless of if I'm an Orthodox Jew and you are a born again Christian, or Muslim. It doesn't matter. You have to just really put away whatever your beliefs are and just say, what does this person need?
Yeah.
So
yeah, I love that. And it's true. I'm open to all, if you believe in whatever you believe in, it's great. Just believe, just have that. And if you don't, that's also fine. It's just what matters is that you are okay with yourself and where you're going. And a lot of my treatments are guided by that, my intention on the way that I treat my patient. I believe that that's such a big proponent to any treatment, is the intentionality behind it. So I could, put the needles in someone, but what about my intention? What do I want to deliver? What do I want to give that person? What do I want them to leave with today?
How do you do that, right? Because it's just a physical thing that you're doing. It's a skill that you're performing.
Yeah.
So how does that differ depending on the patient that you're dealing with?
That's the relationship. So once you get to know the person, there's a difference between healing and just like practicing the medicine, right? If you believe that you can help heal someone, then the intentionality really matters. So if we're having a conversation, you get vibes. right? Like you get vibes from a person. That is the intentionality that that person has. You can read that. It's energetic. It's there. You can't see it, but it's there. So it's the same way as when you're with your doctor or you're receiving a treatment, you can feel something from them. Do you feel good around them? Do you feel like they're taking care of you? So that matters. It helps heal the person on a cellular level because it's what they're receiving. If you're just pouring from an empty cup, then what are you giving others, you know?
Yeah, nothing. It's dry.
It's dry.
It's dry. You're not connecting. And then there's a loss of trust. There's a loss of rapport. They don't feel cared for. So I think that was probably, when I was teaching at UM, that was probably one of the main things I would tell students. It's like, if you're really here, you have to care. Like, if that person doesn't feel like you're really invested in them, you could be the best provider in the world in terms of understanding the rationale, the treatment plan, et cetera, et cetera. But if you don't have buy-in from the person who you're supposed to be treating, guess what? They're not going to follow through with that treatment plan. They don't believe that you have their best interests. So you've already lost them.
Yeah. And not everything has to be fast.
Yeah. Tell that to society, right? Not everything has to be fast. Everybody wants the quick fix, though.
Yeah, that's one of my biggest challenges, honestly, for being blunt. I feel very challenged.
We're only blunt here. Like, you need to come with the heat.
Bring the heat.
We cut straight to the chase.
Yeah.
Why do you say that? Why do you say that's your biggest challenge?
Because as much as you want to give the people what they want, like we said earlier, sometimes I don't want to give the people what they want because it's not in their best interest. And a lot of people come asking for an immediate solution. And I would love to just like, here you go. You're fixed. Fix me. Okay, I could fix you. I can't do that all the time. I could help you, but I can't just make the problem go away. And it takes consistency. It takes someone willing to put in the work themselves, because once they leave my office, what they do at home matters just as much as the treatment. And, you know, pharmaceuticals, it's so easy to give someone a pill, Tylenol, whatever it is, and they feel great for a few hours. And then it's a repetitive cycle. You do it again, you feel great, and it's instant. So the instant gratification that people want, I cannot always give. And, you know, if I do care. I care about my patients, so I want to deliver a product. And sometimes I'm afraid. There's that fear. There's that fear of, am I doing enough? Am I really helping them as much as I could? They're not getting the results immediately. What can I do better? So, you know, you go into that spinning of imposter syndrome. What can I change? What can I do? Am I going to lose
Because even
patient?
you as a clinician want some sort of instant gratification or some sort of healing to take place.
Yeah.
Because it's almost like their wants and needs are rubbing off on you. And it's like, damn, they want to get cured now. I know that that's not physically possible, but am I doing enough to help them get cured as quickly as possible?
Yeah.
And so then you run into this weird dance where you know that it's a long-term solution, not a short-term solution. You don't want to just put a Band-Aid on an ulcer.
Yeah.
Like, you really want to bring some sort of healing, but you don't want to rush because you know it takes time.
Exactly.
But they want you to rush.
They want you to rush. So you're like, okay.
So I'll give you an example. In psych, it's always anxiety is the number one reason people come in. And there's plenty of people who come in who have a long history of being on some sort of benzodiazepine, whether it's Valium, Xanax, Klonopin, whatever medications. The problem with these drugs is that they're extremely effective. You have anxiety, you take a Xanax, put it under your tongue, even if it's like 0.5, if you haven't built a tolerance to it. Oof, you're floating on a cloud. You're good. It's also addicting.
Yeah.
So if you do become dependent, and this becomes a cycle where every time you start experiencing anxiety, you go to the Xanax. Number one, you're going to develop a tolerance. You're going to go up, up, up on the dose. And then the day that you decide, you know what, I'm not functioning well, and I need to come off of this medication, it's rough. It's rough coming off. I've seen patients in the psych ward trying to come off of benzos, and let me tell you, it's not something I want to experience.
Yeah.
But it's extremely effective short term. So the patient is experiencing this immediate instant gratification, this alleviation of anxiety that is choking them. But then they're going to fall into this vicious cycle if you just continue to prescribe and give them what they want.
Yeah.
And then the fear from a clinician standpoint is, if I don't give them what they want, they're going to go somewhere else and get what they want anyways.
Yep. Yeah, it's a double-edged sword in a way.
It's a double-edged sword.
But that's okay.
Yeah.
Because then you know who you are as a practitioner and who do you treat and who do you not align with. And that's also something that comes with time and just acknowledgement that you can't always be a people pleaser as much as, sometimes we want to. Speaking for myself.
Yeah, no. And it's funny because in a way, we are in a people-pleasing business. We became healthcare providers because we wanted to help people, to please people.
Yeah.
So it's almost like we want to establish those relationships. But yeah, I think it takes a level of maturity and experience when you start realizing, oh no, not everybody's for me. Or you develop ways to really negotiate with patients, which is something that I learned. Because I think I wanted to be in a rush to get them off the benzos too. It's like, wait, they've been on it for 5 years. Who am I to rush this process? It might take 5 years for them to come off. But if there's education going on and we're moving in the right direction, even if we're crawling in the right direction, there's a light at the end of the tunnel. Yeah. Some people want to come in and be like, I don't prescribe benzos and that's just, it's out of my morals and my ethics and blah, blah. No, it's like, it's a dance. It's a dance.
Yeah, I believe in doing both. I believe in having the prescription and then also like how can you help balance out that prescription? And you don't have to get rid of it altogether. You can do something to help alleviate at least the symptoms because everything does come with this, what do you call it? What's that word? The medication has its
side effects.
Thank you. There you go. Yes, teamwork.
I was like, wait, what? When did I lose you? You know what? Do you mind? I'm going to take a pee break real quick.
Yeah.
My bladder.
Is that going to go on live?
No, I'll clip this out. Oh, so hormones, right?
Yeah.
So I threw on a sweater, so it's going to look like a completely different podcast now. No, I saw you were looking warm, and I was like, well, I'm starting to get cold back
nice
here.
And warm.
Yeah. Sorry about that.
It's okay.
Actually, I'm going to take off my shoes.
Ideal.
What? I'll make it comfortable. Might as well. We're here. All right. It's always interesting to get to know somebody on the mic. So
Cool.
Right?
Yeah, I love it.
It takes you into a different zone a little bit.
Yeah.
And you really have to articulate like what you're thinking and what you mean, because you want to make sure the person understands where you're coming from.
Yeah, you have to be very present.
For sure. And these to me make you so present.
Yeah.
Right?
Can't hear anything else.
No, you just zone out, because when I took it off, I heard all this action going on out there. I was like, what's going on? So I'm going to use myself as a case study.
Do it.
So all right, so here we go. Can we start doing Tai Chi?
We'll do some after. Should have done some before.
That's true. So January, February, this has been probably one of the most difficult years business-wise. Like you see all these people here. Cool, there's a lot of action going on. There's always things that are going on behind the scenes. The office manager that was here originally, we had a little bit of a falling out. Whatever, shit show. It's okay.
Happens.
Things happen, right? As your business grows. And nothing but respect to her. It's fine. But stress starts coming. Just so you know, so this is an insurance-based business. I'm going to give you details, even though you don't want them. Too bad.
I did ask earlier, actually.
What did you ask?
I asked, what do you do here and what's going on?
Oh, yeah. She's wondering what the hell. She asked me, why aren't you seeing patients? So she's like wondering what I do here exactly. And I'm still not sure, but it's okay. I do a little bit of everything. I try to. I'm involved in the marketing. I'm involved in day-to-day operations. I'm really trying to make this like a fine-tuned machine from a business standpoint. So that way, if I do ever step away and disappear to another country, I don't have to worry about it. That's my plan. And so that's why I'm involved in day-to-day operations, but it's more so I check in, you change some variables, you step back and you trust your people. My leadership here is very chill. I'm not like this. I don't know. I've seen bosses that are assholes, and
Micromanaging.
I don't micromanage at all. It's like, hey, these are the things that need to get done. I trust that you know how to do it. So like, let's make it happen.
Yeah, it seems like a very positive environment, which I really appreciate.
So it wasn't that before, which was where a falling out happened, which is okay. But there was an issue with, we switched electronic health records. When you switch an electronic health record, no, I'm sorry. When the original office manager departed, there was a lapse in billing. The person in place didn't have the same knowledge. So all of a sudden, the money just came to a stop. Incoming revenue. This is 20 people that are depending on this practice to function, to live, to sustain their day-to-day living. Never did I put anybody in jeopardy. It's like, I would have been the last one to eat. I don't care. Everybody else is going to get paid. I'm never going to do bad business. That's just, I don't operate that way.
Yeah.
So it was a scare for a while. Then we figured it out and boom, we had an influx of money. But in that time, my cortisol levels must have been through the roof. I was losing sleep. I was checking my bank account every night at 2, 3 in the morning. I was just I was confused because we were seeing the same volume of patients, but there was just no revenue. All that being said was just to say I was really stressed.
Yeah.
Come February, March, April, May, things had already corrected themselves, but I was not feeling good. And so I was like, okay, I'm either depressed because I'm having symptoms of anergia, lack of motivation, lack of concentration, just feeling a little bit low. And I'm typically a little hypomanic. I'm a little bit more on the hyper side, like annoying, but it's okay. But it's okay. And sorry. So I said, something's wrong. Let me get my labs done. And when I checked my labs, my testosterone was like in 200 something.
Well,
it was shit. And I said, oh, at least this explains it. There's a metabolic reason as to what is going on. There's a hormonal reason as to what's going on. I was so out of it that I was forcing myself still to go to the gym. Everything else seemed okay, but it was just that lack of motivation, lack of energy. And I remember just thinking, today's garbage day. All I have to do is pull that green bin from the side of my house to the front driveway. And that task felt like
dreadful.
Such a dreadful task. It's like, why do I have to do this? Oh my God. Now it's like, I'm ready to go. Like, what is garbage day? Let's go. It's so weird, right? It's something so normal, but that was probably one of those key indicators for me that something was off. And as soon as I got my levels checked, I started taking exogenous testosterone. I've been taking testosterone now for a couple months. I feel great. I'm seeing the muscle pack back on. I feel good overall.
Yeah.
So now, here comes Dr. Suarez. So the first thing I ask is, and I didn't ask myself this before because I just what do I want to do? I want to correct the problem immediately.
Yeah.
Right. I don't know anybody else that's practicing traditional Chinese medicine, nor did I ever even think to seek it.
Yeah.
Right. I didn't see a nutritionist because again, my mindset is TRT. Like this is a simple solution. Yeah. So now what would you say to somebody like myself who comes to you and is having this hormonal imbalance, has low T? I'm a 40-year-old male, very active, been active all my life, and I'm just experiencing the symptoms that I have already told you. Where do we go from there if I'm coming to you?
Okay, so I would start from the beginning. When did you start feeling different? Or when was the last time you felt like yourself? And that just leads to a cascade of everything. Medical history, what have you done in the past year that's been different? Relationships, sleep patterns, everything, your job, what changed? Yeah. Where did the change occur? And
I told you, everything that lacking sleep, a lot of stress, just kind of on edge. So checking my bank account in the middle of the night.
Right. And so we would, if it depends on who you are and how you think. Some people will know and acknowledge that that's where it started and that was the root cause. Others would just say, I don't know how I got here. Like, what happened? Maybe it's the age. And chances are it's not the age because you yes, your hormones do change with age, but it shouldn't be catastrophic to the point where you're feeling so low that taking out the trash was like, fighting World War II.
Yeah.
It's like, what's going on here? Shouldn't be that difficult. And we see that now so much. So I would ask, where did you see the change? Get to the root of the issue. Once I know the root, and that could take time. That could take, let's go see your labs. Like we keep joking about every time someone asks me something, I'm like, where are your labs? I like to see. I can't just look at you and tell you, okay, this is what you need. What if it wasn't DRT that you needed? You obviously, you're well informed. You got your labs done. You saw that it was your testosterone that was low. You took the TRT, great. But there are so many other things that you can do also so that it doesn't happen again, or to prevent it from happening, or to just also let's fix all the other little things that could have gone wrong there. Because the testosterone itself, it could have been catalyst. The low testosterone could have been catalyst to what so many other hormones, or your cortisol levels, for example, right? Or it could have been your nutrition wasn't on point at that time. Your sleep, how do you produce hormones, right? When you're sleeping, your human growth hormone, what time of the night were you not sleeping? Was it 5 a.m? Because that's when it's most potent. Or there's so many other little things. Were you having a rough time in a relationship at the time? That's emotional, could have caused also the symptoms that you were experiencing. So I like to get to know what happened, how it happened, when it happened. And then we move from there, and then we come up with a treatment plan.
So do you feel that a lot of people are just lacking self-awareness, and so they don't take the initiative? Like we were having a conversation about somebody who's very irritable and anxious and on edge. I mean, I guess much like I was, but this individual isn't seeking treatment. They're blaming it on other things. Do you think self-awareness is a huge, not proponent, but a barrier for people to seek treatment?
Yeah, and I think that's where mental health comes in. It's so important. I think that we're only willing to look as deep as we want to, really. Like sometimes ignorance is bliss, because if you're not having to look at it, you don't have to pay attention to it, then nothing's wrong with you. Then you want to blame it on everything else. And then you want to point fingers, and then you're hurting the people around you at the end of the day. Because, if you're in a relationship, you're in a marriage, that marriage is going to suffer because you're not looking out for yourself. So I do think that that's a big issue now, for sure.
How much of a component was, I always laugh at myself when I hear those afterwards. I'm like, how? I'm like, what the hell are you doing? My brain was like having trouble starting. How much psychology was involved in the TCM?
A lot, actually. Yeah. A lot of it, like not just psychology as in like behavioral medicine, but just like I said, like the Taoist, the philosophy behind it, the mind, body, and soul aspect, like how connected is the mind, the body, and the soul. And can you split them? Like if you really think about it, if in an abstract way, can you separate the three?
No, of course not.
So then that's the way we see it. It's like the three are one, and you have to treat it as one. You can't just separate each and come up with a solution for, something separately. Because then that's when you're just putting a Band-Aid on the issue. So a lot of it was psychology based. We took behavioral medicine courses. I personally took other courses outside of my curriculum so that I could be more well informed
Like what?
in mental health. So when I went to the University of Miami, I took an in-depth behavioral medicine course, which was for nurses, actually. And it was psychiatric care, and it was psychology also. So I learned a lot of what you must have learned in school. And I also learned about extreme mental health conditions so that I can see the difference between a person who is just suffering from something that could be treated with a mental health counselor versus someone who needs more in-depth care, like psychiatric care. That was important for me.
For sure.
It's not always easy to
distinguish.
Exactly.
Yeah.
Thank you. Yeah.
Yeah, I could definitely see. And the reason I asked that is because, for instance, in a nursing program, whether it's a nurse practitioner program or a traditional nursing program, there's one mental health course, We're talking about family nurse practitioners who are, if you are going to see an internal medicine doctor, chances are you're seeing a nurse practitioner right now.
Yeah.
There's a shortage of physicians that are going into internal medicine. Chances, and also corporations that are not owning a lot of these internal medicine clinics, they're employing what's better for them financially, which is a nurse practitioner, which doesn't mean that they're not trained for it. But in a nurse practitioner program, they have one mental health course. No, I'm sorry. They have one mental health lecture.
Oh, wow.
Yeah. And I'm talking about University of Miami, Florida Atlantic, FIU, St. Thomas, whatever school in this area that has a family nurse practitioner program, the amount of actual coursework that involves mental health is so little, which to me is terrible. Honestly, it's just terrible. It's a disservice to the clinician. It's a disservice to the patient that clinician is going to serve in the future, because you're seeing the blend and you're truly looking at it holistically. And we love to say family-centered care and we love to use the term holistic, but are we really?
Yeah.
Are we really thinking about, how self-aware is this person? Are we looking at the family unit, at how this person is involved in the community, how this community has shaped them, how this illness is impacting that person's role in the community?
Yeah.
What stressors come from that? So
and I love that. And it's true. And it's also something that is just about education, because how do we really know that? Yeah. How do you become self-aware? Is by being educated on self-awareness.
Yep.
So it's a matter of actually wanting to go there with your patient. It takes a little bit more than just, one session and this is your treatment plan. It's like really focusing on the person as a person and seeing like, what do you need from me as a practitioner?
But isn't it different for you? Because right now you're an entrepreneur, right? You have your own practice. You kind of set the time. I saw the times that you have. Typically it's an hour with a patient, and the insurance-based model this business isn't sustainable that way.
Yeah.
I've extended it, like pushing those boundaries, but I also know that the limitations. And so the only way that I can handle that is the psychiatric nurse practitioners can handle, especially in the initial eval, they can kind of dive deeper into it. But as they move along, they need to recognize this person needs therapy, so we need to refer to therapy.
Yeah.
And this individual can't treat all of those things by themselves. They need a team member to help them.
Yeah.
Because it doesn't work.
Yeah, that's where I'm at right now.
Where are you at?
I need help.
Okay.
So I can't do all of it. It's not possible because I'm one person. I don't take insurance, and I charge just based on the time of service. So if you're with me for an hour, I'm charging you for the hour, to be fair.
Yeah.
But I'm putting work in at home. I am constantly on my computer. I'm constantly doing research. I'm reading. I'm thinking about my patients, like what about this? What about that? And it could be exhausting for me, as much as I love it. And then you need to refer. I have my mental health counselors that I refer to. I have my other doctors, practitioners that I would refer to as well. My PTs, my, whoever it is that they need at the moment. But I can't do it all on my own. And a lot of it is the patient feels comfortable enough in our session to just let it out. I always tell them, bring it. Like whatever it is, just let it out. Let's let it out on the table. And chances are they're going to feel better just with the acupuncture treatment and the energy work, because that's what I do. I do the energy work, I do the acupuncture, and I help remove some of that excess energy that they have built up in their bodies in a somatic sense. But then they need to go outside, and they should seek a therapist if they need one. So there's a network that needs to be combined with all of this.
For sure. So I guess it goes back to, that is the solution, right? Because
I can see you thinking.
Yeah. Sorry.
It's great.
Yeah, because the solution is to refer in the system, because we do. I think there's a part of we went to the art room in the psych ward, and it was funny because there was a Superman symbol that was there, and Superman was like my idol as I was growing up. That was my superhero. I had Superman everything.
Cute.
And it's kind of the mentality that you come into caregiving with, is that you are the superhero, you are the rescuer.
Yeah.
But then sometimes that's also your kryptonite, because
Yes.
you can't do it all by yourself, right?
Wow. I love that you said that.
Yeah.
Rescuer cannot. Like, that's something actually, I have a therapist.
Mhm.
And that's one of the main things we work on in therapy. There's a triangle. And
Guilty.
have you heard of the triangle? Oh, so good. If you haven't heard of the triangle, let's put it out there for people.
Go for it. And I'll give you my story once you're done, but please.
Man. So the triangle involves the persecutor, the victim, and then the rescuer. And you are like a ping pong ball between that triangle constantly when you are in fight or flight, when you're in argument mode, when you turn into your little kid, right? Because when we're arguing and we're scared and we're hurt and we're triggered, we go back to that little kid. And that is something that we all do. We all have it. We all go to one corner more than the other. Chances are you go to one corner more than the other. I tend to fall in the rescuer corner. I want to rescue immediately.
So it's rescuer?
Yeah.
Sorry.
Persecutor.
And
then victim. And it's called the victim triangle because it is a victim triangle. But at the end of the day, you could fall into either one of the corners. Which one are you?
I'm the rescuer.
Ooh, you too, huh? Yeah.
Which actually, here's a great story. I think I've told it once before. I don't know if I posted it or not, but I went to jail.
Oh.
Yeah, I spent a night in jail because of this triangle. And the only reason I learned about this triangle was because I was required to go to individual therapy. Well, actually, they put me in group therapy first. So here, long story short, it was a dispute between my sister and I, right? I won't get into the details. I just didn't agree with the relationship that she was in and how it was affecting my niece. I'll leave it at that.
Okay.
So me and my sister get into it. I'm 26, 27 years old. And it was a screaming match, and then it was like me shaking her and her yelling at me, and then her trying to hit me and me blocking. Like, I'm stronger than her. I'm not trying to hit my sister. Yeah. But police show up, and what happens? My sister's a beautiful young lady. She's 42. No.
I hope she doesn't hear this.
I hope she hears it. And I hope she's smiling or angry. I love my sister to death. I'm huge on forgive and forget. I'm good. I was water under the bridge like
so long ago.
Yeah, but it was even immediately after. I was like, "You're my sister. I love you. I don't care."
That's great.
Like, it's all good. But I was forced to go to I spent a night in jail, like in TGK. Got transferred to downtown to the Richard Gerstein building. Interesting experience. And I say this smiling now because it was crazy. Actually, when I went to China, I had to ask for permission to leave the country. I'll never forget. It was the weirdest thing. I had to stand in front of a judge and say, "Hey, I have a trip planned. Can I go? I know I'm still part of this program."
Oh, wow.
Yeah, weird. I'm just recalling these things now. And when I sat, it was with a master's. She was a student. But when we started going over it, she drew this triangle.
Wait, do I know her?
No, I don't think so. I don't even remember her name.
Oh, okay. This is like very rare that people actually know about this. So it's
cool. Really? Yeah, she was a student from either Barry or Nova, I remember. No, but this is common in therapy for sure. But when she drew it out, I was like, "Oh, I'm the rescuer." Yeah. And then being the rescuer isn't like being Superman.
No.
It puts you in stupid situations. I was in jail because I wanted to be the rescuer. And I've had to relearn this because I'll get into another situation and I'll realize, oh, wait, I need to step away from this. This has nothing to do with me.
No, exactly.
And when people know you're the rescuer, what happens? They call you. They reach out to you. You have to solve their problem. You have to get involved. You have to intervene.
And if you don't, then
you feel guilty.
Exactly.
You feel like you let somebody down. You feel like you're not doing enough.
You're giving your power away. Constantly giving your power away. Yeah, exactly. It's being a rescuer is not, necessarily
a good thing.
Yeah. Well, yeah.
Yeah, it's just about boundaries, right?
Yeah.
You have to understand like what your limitations are and say, okay, this is where the buck stops. Whether it's me taking care of a patient that, hey, I can't do anything else. I don't give Suboxone. You're addicted to opiates. I definitely need to get you into inpatient treatment.
Yeah.
Or somebody's calling you about the relationship issue. Don't step in. Let them handle it, or refer them to somebody that will help them do that. That's objective and not part of your personal life.
Yeah. Even in relationships with your partner, are you constantly rescuing them? And rescuing doesn't just mean helping. It means also like when they're going through a tough time, you could be there for them. That's support. That's not rescuing. Rescuing is when you're giving up yourself for the other individual. Codependency. Rescuing is the equivalent of being codependent. Yeah.
And being codependent in situations that you don't even belong in.
Yeah, exactly. It doesn't belong to you. Forget it. Not my monkey, not my circus. There you go.
So there you go. When you started talking about the triangle, I had a flashback to this woman drawing a triangle on the table. I was like, here we go.
I learned this through my therapist, and it just like changed my life, honestly.
Why? How has it helped you, I guess?
I see it now. Just the moment that it happened, it's like a flip of a switch. And when you realize it, you can get out of it. If you don't realize it's there, then you're going to live in that triangle constantly forever and ever and ever. So now in relationships, I'm trying to be more aware of where I fall into that when and how. So then I'm able to step away and just change my behavior so that I can be my best self. Because if not, you can imagine you walk around with that. It's heavy, constantly walking around with that, especially family dynamics. So it's helped me a lot with family and relationships and friendships, everything. And it just like helps you chill out a little bit.
Yeah, because you realize, oh no, this is my boundary. This is where I step away.
Yeah.
Instead of just getting worked up into a frenzy over somebody else's issue.
Yeah, with patients too.
Yeah.
You take their stuff home with you and you take it personal. And you're like, oh, you're thinking about like Silvia. Ay, pobrecita Silvia.
And Sylvia's at the bar having a beer.
Exactly.
Not even worried about anything you told her that day.
Yeah, exactly. Not that Sylvia's a patient, by the way.
No.
Just a name. Oh, man.
So I don't even know where I was going.
We're going with hormones, and then we got to the triangle.
There you go.
That's
You know what's
it?
I actually just had this thought was the fact that I keep on trying to tap into the science. And we keep on going back to psychology.
Yeah, that's my fave.
Is it?
I can't help it. Yeah.
So how do you deal with patients that are extremely anxious? What's your remedy? Because I can use SSRIs, I can use Zoloft, Paxil, Prozac, CBT in terms of cognitive behavioral therapy. What are some of the modalities that you use to help people? So
I specialize in anxiety and depression, things like that. So most of my patients come to me with those. Would you call it a condition? What would you call it?
Yeah, condition.
Yeah. Okay. So it's called condition. So a lot of the people come to me with that. So I, again, get to the root of it. When did it start? When did you feel normal? When did it change? And with that, some of the tools that I'll use are behavioral tools. So we'll talk about lifestyle habit changes, something as simple as being more mindful in your day-to-day. How you wake up will set the tone for the rest of your day. So I'm a huge fan of Huberman. Like, who isn't? Right?
I think a whole bunch of girls are fantasizing about Huberman these days, you know?
Especially when he took his shirt off just recently.
You see, I knew it.
Dead.
I knew it. That's it. The guy's smart and he looks like a caveman. And the girls are, oh, yeah.
Oh. It's horrible. Okay, no. But he's great. His podcast is very, very... It's
extremely informative. Yeah. He cites the literature. He's the real deal.
Yeah.
And he's not afraid to challenge like his position. I mean, he's a Harvard or he's a Harvard professor, no? Stanford, I'm sorry. He's a Stanford professor. And yeah, it's a little bit ballsy of him because he's probably tenured too.
Oh, super. Yeah.
Yeah. So he doesn't have to worry about losing his job based on what he says. And he's citing it based on evidence. He's very careful about what he says because when he doesn't know, he says he doesn't know.
Yeah. For sure. I love that. Yeah. And I do use his podcast a lot for just like research purposes, like the one you sent me the other day. Amazing.
Yeah.
So I use that in my patients. I'll tell them like morning light, very important for your mood. Little tools, little things they can just do on a day-to-day basis that don't require much effort. Because when you're depressed and you're anxious, the last thing you want to do is pile up, like add more to your plate, because your plate's already full. That's why you're coming here in the first place, right? So little things either that you could remove to ease your day, or you can add that will just simplify and make you feel better. So I work with those behavioral tools. Then I'll go into nutrition. So are you nourishing yourself? How are you nourishing yourself? What kind of foods are you eating? Then how much alcohol, how much caffeine, the correlations between that and your mood, obviously we know. And then through the acupuncture, I can help tame the nervous system. So if it's depression, I'll help bring them up. If it's anxiety, I help bring them down.
How does that work?
The nervous system. So so acupuncture.
Yeah. So acupuncture. Here we go.
So acupuncture. There's meridians, and all of these meridians are, let's say, like highways in the body. So you have the turnpike, you have 836, you have 826, and it's, let's say, energy flowing through them. And this is the traffic. So all the cars are just going. If there is a traffic jam, what happens? You can't get to where you need to go. So in order to clear that in the body, you need to open up that channel. So you need to open up that freeway. There's energy constantly flowing up and down, which is also neurons, the nervous system. You have all of your neurotransmitters. You have all of your blood, your cells, your lymph. All of these things are constantly moving. If something is obstructed, can't go through, then this is where all the issues arise. So through acupuncture, the meridians have specific points. Every single point has a message that you can send. So you put the needle in, let's say, the toes. So there's the big toe and then the toe next to it. There's the web of the toe. You put needle, it's called liver 2 or liver 3. You put a needle there, and then that will send a signal to a specific part of the body.
I'm scheduling an appointment for tomorrow.
Oh my God, let's do it. So it sends a signal and it releases a neurotransmitter, or it will send a signal to opioid receptor. So to ease pain, or it could also just help relax on a local level, like muscle function. You can do blood, so you can help alleviate any kind of pain, just bringing more blood flow to the area. And
so what's the difference between dry needling and acupuncture?
I can't say that I can speak on that because I don't do dry needling.
Gotcha.
And I wouldn't want to say something that is not true.
Oh, it's okay. I'll just tell you what my physical therapist told me. Shout out to
I
Juan
love that.
Guzman out of AirFit Rehab, or I forgot what it's called, but his business is called Inspire Health PT. So Juan, I had an injury to my right hip, and he started using dry needling with electrical stimulation, and it was just the same thing. You're creating micro injuries to that site just to draw more blood flow and naturally facilitate healing.
Yeah.
Same with the electrical impulses. So that was basically the gist of it.
Yeah, I do that.
Yeah.
I do the same. I do with the needle, I'll connect a little hook on it that is connected to the electrical stim machine, and it sends electrical impulse through the needle into the wherever you have the location of the needle, and it will create the same reaction. So in this case, you can stimulate muscle twitch, or you can just do it to cause the micro tears and then bring more blood flow and also more cellular activity to the area.
Gotcha. So how is that different from the meridians or the turnpike and the congestion that you were talking about?
Because you can do it on a local level. Like if you're going to treat muscle pain, for example, or an injury, you would go just like for what I think that dry needling, you go straight to the area, right? That's how you've experienced
Correct.
it.
Yes.
In our case, we will put a needle in the hand that will send a signal that does something to the ear. Like it's that motorway that leads to the ear. And all of these meridians lead somewhere differently. And it's so specific to the point. Like you have to know the nerve ending. You have to know which artery, vein, every single muscle fiber that is in that area. You should know because you want to send the right signal, the right message. And it's all controlled by our brain, our spinal cord. And you can also do energy work if you believe in that sort of thing. So as you're treating the person through the actual needle and the point, you can help ease them through breathing techniques, through intentional, I don't know if you know what Reiki is.
I know what Reiki is, yeah.
Okay, so if you're into energy work, you can help stimulate the body through the energy work. And then I also help my patients through either meditation or to just talking to them, helping them feel more comfortable, helping them feel supported. Love is so powerful. The minute you just give someone a little bit of support, their body just like relaxes, completely relaxes. And it helps them to then get the full treatment that they need. And when their muscles relax, then there's more blood flow. The neurotransmitters are more readily available, and you can help the person in such a holistic way. So yeah, there's just so many things. It's so beautiful.
So, I mean, the only thing I'm thinking about is like you're a healer, right? And like in the raw sense of the word, because so many of us are healthcare providers, and I feel, I mean, I'm just through this conversation is what I'm coming to this. So forgive me if I'm just rambling, but like as a healer, I mean, you're investing yourself. You just use the word love, right? How many providers are going to say, I have to love my patients?
Yeah. Well, thank you for acknowledging that.
Yeah. I mean, how many people are going to say, I have to love my patients? That's deep.
Yeah.
Right? Most people don't think that way.
No. And I think that's where my faith comes in. I'm a vessel. I'm a tool. You know, I'm just like, whatever it is that's flowing through me, that's what I give. I, as a human, just like raw humanness, like how much can I give? Where does this power come from? And I think there's a source, and that source is driven by something, and it comes through me. And that's how I try to treat my patients. I pray before every session. I pray for my patient while I'm treating them. And it's just my style. It's who I feel like I was placed on this earth to be. And it's why I'm so passionate about it, because I genuinely care and I treat with that conviction. If it wasn't for that, I honestly don't think my treatments would be effective. As much as the needle, yes, it does the work on a physiologic level, on a cellular level, but the rest is really just up to source and working through me.
I took a course at FAU, and her name was Dr. Purnell, and I have to look at her research again. And I remember all my friends that were in the course with me were blowing her off. The study's full of it. It was the theory of caring. That was the course. It was the first introductory course at FAU. I don't even know if they still offer the course. I don't know if it's still the philosophy that drives that school. To me, it made such an impact. It impacted me so hard because I could relate to it. Because part of it was self-care, right? And one of the first assignments was spending a day taking care of yourself. It was the first time I ever got a massage in my life.
Wow.
In my life. I was 20 something years old. And I walked out of that massage like, I get it. And then every course after that was like, or every class after that was just that. It was the importance of caring for somebody else. And not only just caring, but the evidence behind caring, loving on the patient, and how much of an impact that made on the outcomes. Patients who have family members at the bedside have better outcomes. Why? They're receiving love and care. There's more eyes on them. Touch, the power of touch you were talking about. I know Reiki is not involving touching, but just the power of touch. Yeah. And when you're dealing with a delicate situation, when is it appropriate to touch somebody? Yeah. Obviously, you ask permission. Hey, can I put my hand on you for a second? I just want to help you get through this. Those are things that I think a lot of people don't implement into their practice, whether they're pressured for time or whether they're pouring from an empty cup.
Yeah, or fear. Just fear of like,
this person is going to judge me because of the way I'm practicing.
Exactly. Or the public, like I'm sure there's always pushback.
Oh.
Like, the things we're talking about now, some people don't relate or agree. And there's pushback. So that creates that fear of actually talking about it or speaking your truth. That's my truth. That's the way I treat. It's not for everybody, and that's cool. That's okay. But if you feel it, do it, because who knows who you're going to impact. And I love that you took that course and that you learned something from it, because, you know, you could only meet people as deep as you meet yourself. And
I love that.
yeah, you get to know yourself on a deep level. You can see people differently. You see the depth in people if you really start to get to know yourself.
Yeah, you stop judging.
You do.
Because when you start realizing how imperfect you are as an individual, I think when we're younger, we try to, I don't know, maybe my ego was just bigger. I just hadn't lived enough, and I hadn't been, I guess, kicked in the face enough by life where I thought I was the shit.
Yeah.
Maybe I thought I was cooler or smarter than I am or than I was. And now I just realize, like, nah, this life is so quick. This life is quick.
Yeah, and it's just a facade. You know, my therapist does this powerful representation of, like, as from a young age, how you start putting veils on yourself. Like, you start piling up veils and veils and veils. And it's just through experience what has molded you based on conditioning. And how conditioned you are by a certain age is how you're going to act and be in the world and how you're going to perceive the world, right? And it's a matter of, like, bringing back your innocence and tending to that inner child, and just to realize we're all just living a human experience and doing the best that we could. The minute we're judging someone, we're judging ourselves. That's some shame that lies within us that we're not looking at or addressing. And that's when you start to feel compassion, because if it's in you, then be compassionate for that other person that has that same thing that you do. And that takes so much practice, because we're constantly judging ourselves. How hard are we on ourselves on a daily basis?
You articulated that a lot better than I did by saying we get kicked in the face a lot. It's like,
I got it.
yeah, I think you got
I
it.
love that. So cool.
Very, very cool. But yeah, I think as you grow older, you mature, and I think you learn to love yourself. Well, I think if you are evolving, you learn to love yourself more, and hence you accept people for who they are and what they are, and don't hold them to standards that aren't realistic, not even for yourself.
Yeah. And in that case, you can be yourself even more. Just be. Just, you know, it's okay. It's okay to mess up. It's okay to look silly. It's okay.
Hence this.
Yeah. Like, what?
Yeah.
Who's judging us?
I really don't care.
Yeah.
I'm at the point, I can't say I don't care completely, but I've definitely let go of so much of it.
And it's so relaxing.
Oh my God. It's a relief, right? It's freeing. Because like, I'm worried about the judgment of some random guy that has nothing to do with my life.
Yeah.
Like, really?
Yeah.
But that's so many people are living in fear of what people are going to judge them for their next post. And it's Instagram. Like, you're supposed to post.
Yeah, for
you're
sure.
Supposed to reveal whatever you want to put on there on display. But then you're worried about whatever you're going to put on display, and worried about
how it's going to be perceived.
How it's going to be perceived.
Yeah. Wow. I love this.
So the coolest part about these conversations, again, I tell this, I haven't posted it, the one with my daughter, but I talk to her about it all the time, is the fact that I come in here, nobody's paying me for this, right? A lot of people won't even view this. Like, the views are very low. But what I have gotten out of every single one of these conversations is invaluable. Conversations that still, like, circle in my mind sometimes, or a situation will come up and I'll be like, oh, Cam Adams is a boxing coach, and he was on here. Had a life-ending motorcycle accident where he was revived on the Venetian Causeway. Came back from, like, he was traumatic brain injury, had to learn how to walk. Now he's a boxing coach. He's awesome. He's a great guy, amazing energy, best boxing classes I've taken in Miami. Just brings it. And he's a cool guy, right?
Yeah.
But his story still circles in my head about resilience and overcoming. Daryl Stingley, who's a parkour athlete, can climb walls with his hands. Like, if I show you videos, you're going to be like, what the hell? This guy's a comic superhero.
Wow.
But we had conversations about race. that were deep, right?
Mm.
And those conversations stay with me, and what he's overcome and what he's been through. I don't know. This thing just it's power. These mics are powerful. These conversations are powerful. And I think it comes down to just being able to sit across from a stranger and look at them face to face and hear their voice through these headphones and just be so intimate, right?
Yeah.
With disregard for time or your cell phone or anything else that's going on in the world, and just be able to be here. And I don't think we're doing that enough as humans.
No.
And so this is my hack.
Yeah. I love that. That just gave me an aha moment.
Yeah, this is my hack. Like, I don't know you. You don't know me.
Yeah.
But after we leave here today, like I got chills right now. After we leave here today, there's something there
Yeah.
where 5 months will pass and I will pick up the phone and call you and you're going to be like, hey, what's up?
Yeah.
How are you doing? So weird.
It's a bond.
It's a bond.
And you're never the same after it. It's good.
So crazy, but it's
So simple.
It's mics and lights. Like, do you really need all of this? Do we really need all of this to get the same effect? Like, do we?
Nowadays, it's wild because this is what it was before, wasn't it?
I hope so.
Like, can you think back and when you were younger, isn't this what you used to do?
Yeah, I used to
Like-
sit on campus at UM and have conversations about the Bible. I used to carry a little New Testament with me.
Mm-hmm.
And my friend James is gay.
Mm-hmm.
And we would just talk about what I was thinking. And he would ask me, well, if I'm gay, then what? And what do you think of me? And we would go deep,
Yeah.
right? But we were just being raw and real. And there was no hate. There was no judgment. It was just like, well, this is what I'm being taught. And I don't understand the way you're living, but tell me about how you're living and why you make that choice. And it was an exchange. And I'll never forget those conversations with James, right? Or with my friend Mike or whoever it is. Because I just wanted to understand them and who they are and their perception of the world.
Mm-hmm. It sparks curiosity.
Oof.
And it's not that trying to impress or fear of judgment. It's just curiosity.
Or which tribe are you on? That's why I just put this Obama and this Trump up here. Which side are you on?
You got both.
Yeah, that's why. Because I want to mess with people. They don't know which way I'm coming.
Yeah.
They don't know which way I'm going.
Yeah.
Because we want to label right away and we want to say, oh, this is your line of thinking.
Mm-hmm.
And we're too complex for that. But the media wants us to believe that that's who we are, is pick a side.
Yep. Yeah, it's all driven by that. We were talking about it.
Yeah,
earlier. It's all driven by that.
So, yeah.
I love it.
Yeah. I feel like I wanted, let me just check real quick before are you in a rush at all or no?
No, I canceled my whole day.
Cool.
Not that I had a whole lot going on.
She had a nail appointment, people.
Yeah.
Stop. I don't even know if I want to talk about this stuff, man.
Huh?
Our conversations are going so much deeper than what the notes that I have here that I don't even. What do you have any questions for me? How about that?
Yeah, I do. I saw all of your diplomas and I was like, wow, this guy he's worked. And I think I said that when I came here. I'm like, wow, you're smart. You've worked, like you've done your thing. And your first reaction was, nah. I was like, okay, so he's humble, got it. But you've worked. What made you want to work so hard to get here?
I had a 2.3 GPA in high school.
Okay.
So I don't know what made me work. I just knew that I think it was the same thing that we've kind of touched on in terms of jumping from job to job to job, that I wasn't really sure on which direction to go. So I started off Miami-Dade College, got my associates. I thought I was going to be a firefighter. I thought I was going to do fire rescue paramedic. Shout out to all my first responders, nothing but respect. I just wanted more education.
Yeah.
I always knew I wanted to help people. So nursing, I was in the Army at the time. I was around a lot of nurses. And I just liked the fact that the field was so broad. Like I was like, oh, I'm indecisive so let's go this route because the door's wide open. I'm in the healthcare field. I'm in the, Superman profession where I'm rescuing people. And so once I jumped into it, my first instinct as somebody who grew up with immigrant parents was, where's the money? So I started looking at anesthesia programs right away. Because once you're in nursing with a bachelor's degree, you kind of have this window of opportunity where you can dive into different specialties. So I said, okay, what's the road to becoming a CRNA? Because right now, today, CRNAs fresh out of school are making $300K.
Whoa.
Oh, yeah.
I'm on it.
The school is grueling.
Yeah.
But it's lucrative. It's a good return on investment. It's a smart move career-wise if you want to do well financially. After I shadowed like 2 or 3 of my friends, I was like, I will become depressed if I take this route.
Really?
There's very little social interaction besides with the people that are in the OR. My role with the patient is to put them to sleep, and that's it. I can't say that's it. I don't want to minimize what they do. They are using lethal levels to sedate somebody and paralyze them during surgery. So this is important.
Yeah.
Your words matter. So
Yeah.
my words matter, Adrian.
Yeah. Be impeccable with your
Grow up, Adrian. You moron.
Thank you, harsh.
Yeah. I am pretty harsh on myself sometimes. I think it's playfully, but then sometimes I have to rewind and be like,
80% of that is true.
Yeah. So anyhow, I guess I just kept going, and I knew that mental health was always in me. My uncle suffered from mental illness. He was my guide, my mentor, the person who I idolized, and I saw him going through this cycle, and I wanted to help people like him because I could not rescue him.
Yeah.
And I think that's why a lot of us kind of fall into healthcare. At least I can speak
Me
for
too.
myself.
Yeah. Mm-hmm.
And so it was never intentional.
Mm-hmm.
It was never intentional to continue to go to school, but it was like necessity. And in between, I took little side quests, and I said, oh, exercise physiology and exercise science. Let me tap into that for a second. Took 2 semesters, and I was like, no, it's come back. Photography, which has still remained my passion. But again, these are things that you just take with you. Everything I learned in exercise science and athletic training, still with me. It was never a waste, where some people might think that was a waste of time or effort. But really it's not, because these are things that I carry with me now into my current practice. Yeah. Or into what I do, or into my mentality for what I want to do, which is why I engage with like fitness gyms and yogis, and I see the different things and how they all come together. So that was a long-winded way to answer your question, but
yeah, it makes sense for me too.
Yeah.
And the people you meet along the way really drive also your trajectory, I feel.
Oh, for sure.
Yeah, like there's so many important people that...
And sometimes they're strangers.
Yeah, for sure. Everybody is a teacher in some way, or a guide. Do you feel like you have someone who drove you to your success more so than others, like a mentor? Or something?
You say success, and I'm like, I'm not successful.
Success could mean so many different things, you know?
Yeah, so somebody who has driven me to this point, no, I've had a lot of cool people that I got to be around along the way. From a patient relationship standpoint, there's a doctor, he's retired now. He's traveling the world. I don't know where he is right now, but he works like maybe 10 hours a week, if that. Dr. Jose Orcasita, he's Panamanian Chinese. Brilliant man. But his bedside demeanor and the love that he treated his patients with never left me.
Wow.
Yeah, it was powerful. And I think he did it so passively because it was just in him to engage with patients that way. But what it did to me as an observer, I got chills right now. What it did to me as an observer was it planted seeds that I was like, that's who I want to be. Yeah. I want to be like this guy. And he was wild, and he would say stuff, and he would make me chart, and behind me, he would use my back as a mouse and be like, here, I'm a grown man at this point. And he'd be like, hey, not there, over here. He's like, no te voy a durar para siempre, so ponte a aprender. And I'm like,
that's a great mentor to have.
Yeah, he was cool. Very, very cool. I should call him. It's been a while. I should just reach out to him.
Have you had him on the podcast?
I haven't.
Hey, there's one.
Which it would be good, actually. Yeah. Dr. Casita would be hilarious.
That's awesome.
If I get him to loosen up, I'm sure I'll give him a drink and he'll relax a little bit.
I get a little bar of it.
Yeah.
Yeah.
Yeah, he was my. How about you? Who's your mentor?
Oof, I've had a lot. I've
Yeah.
been very fortunate. My first, the man who just sparked that love of medicine.
Here comes Huberman. No, I'm kidding.
Yes. No, it's not Huberman, actually. His name is Dr. Swirsky. He's an orthopedic surgeon. And he was just, the minute that I met him, I was like, I want to do what he's doing. And his demeanor was everything.
Yeah.
I was 22 years old. I went to Miami Children's Hospital in search for an opportunity to shadow in the OR. And at first I was with a doctor called Dr. Knight, and he was wonderful. He showed me the ropes. He's a general surgeon over there at Miami Children's. And he introduced me to Dr. Swirsky because I wanted to get into the orthopedic department. And I sat at like the edge of my chair, like so nervous, sitting at he's like, do you want to sit back in your chair?
Yeah.
I was like, well,
I guess.
yeah. And he's like, what do you want from me? That was his question. I'm like, I would love to shadow you. And he's like, let's do it. And it changed my life forever. I was able to go with him into surgery, scrub in surgeries. He taught me how to stitch, suture. He taught me how just the body works. Like his knowledge of anatomy and physiology is just wow. And I love the fact that he started medical school way later in life, not in his early 20s. He was like, I think, don't quote me for this, but I think he was like 30 by the time he started his surgery career. And it was so inspirational. And he was just he is an incredible human being. And I still keep in touch. And he's guided me. He's the one that helped me get into He just like never lost faith. And he always encouraged me to keep moving forward. So love him so much.
Have there been any strangers who just said something to you? You know when a stranger tells you something and something just clicks in your brain that it's
Yes. I'll never forget this guy at Whole Foods. You see, you said that. I'm like, yes.
Yeah.
There's this older guy at Whole Foods walking around, and he told me, you have such a beautiful spirit. And I said, thank you. And he's like, yeah, and it's not just your smile. And when he said that, it touched me because I was like, that's like my faith. Like at that point I was shook in my faith a little bit. So I was like, wow, he sees something in me that the guy doesn't even know me. And he wasn't being descarado. It was just like really complimenting. Yeah. And that sat with me. And I took that with me for so long. Like even to this day, I'm like, what do people perceive? And I want it to be something positive. Like, how is my energy out there? Like, am I giving off a vibe? What is it?
Yeah.
So yeah, that really sat with me.
And it's random words, right?
Random.
From a stranger.
Yeah, it's beautiful. And then one more, Judy, my first therapist. She's just, wow. I asked you if you knew her. She just changed my perspective and my confidence. I came to her with actually claustrophobia. And I was going through a really dark time, like just depressed, claustrophobia, some anxiety, PTSD from some situations I had from the past. And she was so graceful in her delivery of mental health and counseling. And we did EMDR. And man, she's incredible.
So with claustrophobia, do you still deal with that at all or no? Like
Ever
you can get into an MRI and you're good?
Yeah. My first experience, the way I got out of it, faced my fear. I went to Australia.
But what?
That's how I faced my fear.
By being on an airplane? Or?
Yeah, just like being in a closed space for so long, and that was a 17-hour flight. So I had nowhere to run. I had to face my fear, and after that, I was like, I'm good. And it was all through the work that I did with her.
Yeah, I can't get an MRI machine.
Really? Still? Gotta send you to Judy.
I'll take a Xanax for this. I'm gonna opt out of this one. Yeah, I can't.
I thought I couldn't either. And I refused to touch any kind of medication. But the EMDR works. Have you done that before?
I haven't done EMDR, no.
Ooh, it's good. Good stuff.
I've heard, obviously I've read the research on it, but I've never done it. And there's a lot more people getting certified in EMDR. Actually, Tiffany's getting certified in EMDR, if I'm not mistaken. Yeah.
Yeah, she can practice on you.
Yeah, I'll be like, hey,
For your postpartum depression.
help. I'm like, please help me. No, claustrophobia. Actually, since we're talking about this, the only times I've had some sort of panic or claustrophobia. So claustrophobia, MRI. Like, I can't do it. Like, I can't. I feel like that's my coffin. I'm going to die. Like, get me out. Give me drugs. I'll go back in. Cool. But the 3 times that I've had some sort of severe anxiety on the level of a panic attack, not freaking out, but like perspiring, that impending doom, has been on an airplane. The first time was coming back from Boston, I believe. It could be because of some gummies I had taken. I'm not sure.
Oh, really?
Just say. But yeah, that feeling is pretty horrible. And I remember saying, this is what I treat patients for. Adrian, let's go to deep breathing. Let's use our senses.
Yeah.
Let's do all these things, guided imagery. Let me open the door. Let me distract not open the door in an airplane. Open the window, distract myself, guide myself through it. No way. No
Didn't work.
way.
No, when you're in that zone, you're in. That's it. You're sitting in there.
So,
but there's, I mean, acupuncture and all of this stuff helps too.
I know, I'm curious. I mean, it's happened to me 3 times in my life. It's not something that's ongoing, and I don't consider myself an anxious person at all. But when those things do happen,
Yeah.
they're real.
Yeah.
And as a clinician, knowing what they feel like is a different story. And I think it's really cool. And I guess we'll wrap this up, but I think it's really cool that you have not only sought therapy before, besides all the curriculum you've taken in mental health, but somebody who experiences therapy understands what vulnerability is.
Yeah.
Right? Because when somebody is asking you about trauma and events in your life, things that you've just brushed under the rug and you don't want to deal with and you don't want anybody to know because there's shame. I want to make sure that people who step into this field are seeing a therapist. Because if you don't have the self-awareness, again, how am I going to help somebody reach self-awareness if I'm not self-aware?
Yeah.
If I'm constantly looking out, blaming the world around me on everything that's going on, I'm huge on look in the mirror. Where are my faults? Where's my responsibility in these different situations that I've been in?
Yeah.
So yeah, like that's awesome for you, and not only for you, but for anybody who surrounds you, because you're able to help them through that. Or help them through the therapy that you've done on yourself, the work you've done on yourself.
Thank you. Yeah, I continue to do it. And my therapist now I adore. And it's different than what I used to do, but it's so powerful. And I just wish the whole world would do what I'm doing, because it's changed me forever. And I'm going to keep doing it because I want to be even more helpful for others. Because there's a limit. You reach a limit sometimes. And I want to get to the next step so that I can be there for others in a different capacity and continue to grow. Because that's what it's about. What are we doing here? We're growing.
What are we doing here? That's a great question. Here comes Adrian's daily existential crisis.
What am I doing here?
What am I doing?
This should be a meme.
The name of this podcast, well, actually, the name of the podcast currently doesn't even make sense. It's the Finding Balance podcast, because I thought it was going to be all about finding balance in life, but
it is.
Really, it's how did we get here? Like, everything that you've been through has gotten you to this moment in front of these mics, across from a stranger, but you're doing the work that you feel that you should be doing. You seem to be living towards your purpose. You're looking for self-actualization. You're looking to improve yourself. It's beautiful. It's a really cool thing.
Thank you.
Yeah, thank you.
I get emotional, so
Yeah, no, it's okay. I mean,
bear with me.
These mics make people cry.
I know.
They do. I think almost everybody who sat here is like, there's this one point in the podcast that I look at them, I'm like, oh, here we go.
What they don't know is that I put eye drops before, like,
just to help yourself out.
Yeah.
Man. Any words of wisdom, anything you want to share before we close out?
Wow. First and foremost, I want to thank you.
You're welcome.
Like, really, from a heart to heart, thank you for bringing me here. And this is so special. It's like one of those moments that you just don't forget and you want to do it again. So I appreciate your work and what you're doing and how you're showing up for people. And yeah, like I'm here, if anybody wants to come see me, have a treatment, happy to help. I don't have all the answers, but I will make sure that I try my best.
What's your Instagram?
So my Instagram is D Suarez OMD, and my website is Denise Suarez OMD.com.
Awesome.
Yeah, we'll share it, I guess. But yeah, I'm just happy to be here. And yeah, there you go.
Well, thank you very much for taking your time, Denise. For those of you guys listening, again, my name is Dr. Adrian Mesa. This is AMP Mental Health, this Finding Balance podcast. And thank you for listening, and thank you for being on here, Denise.
Thank you.
Appreciate you. Cancel this.